A new study says harsher immigrant policies are impacting Latino children's mental and physical health.
It can get worse depending on where you live. Channel 8's Veronica-Preciado joins us now here in the studio with more on this. Veronica?
Latino children make up a quarter of children in the U.S. The researchers found their health could be affected depending on which state they live in. Researchers gave each state an inequity score based on policies about immigrants and attitudes towards Latinos. They say children living in states with more inequities like Alaska, Alabama, and Nebraska had higher odds of physical and mental health problems. Local advocates say there are many barriers Latinos face when it comes to health care access.
Immigrants often work low-end jobs. We do not have the stability or insurance necessary to afford healthcare visits. So that leads to them going when they really are really sick.
Preciado says not knowing the language and the lack of cultural understanding can also lead to wrong diagnoses. UNL professor and co-director of the Minority-Health-Disparities-Initiative says there are also systemic barriers in Nebraska.
Certainly those are things that we found in our studies. So that's everything from on the mental health side, having a therapist available who understands the language, culture, things of that nature.
He says the level of inequities can also depend on where you live in the state.
What you're going to experience in the western part of the state is very different from what you're going to find in Omaha, in Lincoln, and places in between.
He says nonprofits like the Latino-Center-of-the-Midlands are the best way for Latino and minorities to start seeking help and orientation on health access and resources available. And the Latino Center of the Midlands say one way to make it better could be by implementing policies that look at making health care more accessible and less expensive.
All right, Veronica-Preciado, thank you for the report. Coming up on